Good afternoon, everyone. Thank you so much for joining us. My name is Meredith Mason-Blount. I'm the CEO of NAMI New Jersey, and I'm very excited about a wonderful webinar. This is a great partnership between NAMI New Jersey, NAMI New York State, NAMI Westchester, and NAMI Hunterdon. This is made possible from a generous donation, NAMI TD Education Grant Fund Program funded through Neurocrine Biosciences. So them for taking the time and really calling attention to this extremely important cause. I'll hear from Matthew Shapiro from NAMI New York State. Matthew Shapiro is the Senior Director of Government and Commerce, and he is also the TD champion through the Center for Patient Advocacy Leaders. So thank you again to NAMI Hunterdon and of course NAMI New Jersey. And we look forward to hearing a wonderfully educational webinar this morning. Thank you.
Hi, I'm Matthew Shapiro, Senior Director of Government and Community Affairs for NAMI New York State. And it's such a pleasure to welcome you to today's conversation about tardive dyskinesia, or TD, awareness. It is so important that we continue to spread education about TD, as it remains an misunderstood disorder and something there's just not enough knowledge on. And along with my role in NAMI, it's such a pleasure to be able to be a CPALs advocate and help advise NAMI chapters here on the East Coast who have received TD grants through NAMI. So thank you to the generous support of NAMI for making these conversations possible and these awareness initiatives possible. And of course, a big thanks to our partners in NAMI New Jersey. It is such a great opportunity to bring two state organizations together to have these critical conversations. So to Maggie and her team at NAMI New Jersey, thank you so much for getting the ball rolling on this conversation. And it's really such a pleasure for me to have you get to meet two of my dearest friends, Marie Considine, the Executive Director of NAMI Westchester, who is one of the most fierce and dedicated mental health advocates that I have the pleasure to work with, and she's on the front line of so many critical conversations. So you're in such good hands having Marie lead today's conversation. So thank you, Marie, so much for stepping in for me. And Timothy Brown, who's just such a remarkable guy. And we recently had him at our education conference, and I thank him so much for sharing his story. And I really I recommend you checking out some of his other books that we have. He's a incredible poet, a storyteller, schizophrenia advocate. You can go on his little QR code right there and learn more about Timothy and get some of his books. He is such an inspiring voice, and thank you, Timothy, for sharing your story. And thank you, everyone, for being a part of today's conversation. It's so critical that we're here and we're talking about this. There's, as I said before, just not enough understanding about TD, and we need to make sure that people like, doctors' offices, general practitioners, law enforcement, and really all of us who are in the NAMI community and either live with a mental illness or care for someone living with a serious mental illness know about TD and how to have critical conversations around it, and let people know who might have it, how to let them know and help bring awareness. So again, we're thrilled to be a part of the conversation. Thank you for being here today, and enjoy.
Thank you so much, Matt. Welcome everyone to today's webinar on tardive dyskinesia. I'm Maggie Law, NAMI New Jersey's Chief Communications Officer. We are grateful to have you all here today as we explore this very important but often misunderstood condition. Before we begin, a few housekeeping items. This webinar will run for an hour. Please use the Q&A function on the bottom of your screen for questions if you have them, and we'll address questions during our dedicated Q&A session. The webinar is being recorded and will be available afterwards. Now, I'm honored to introduce my fellow panelists today. First is Marie Considine, who is NAMI Westchester, New York's Executive Director. Then Timothy Brown, our mental health advocate from NAMI Westchester, and Shay Dibley, Vice President of NAMI Hunterdon County in New Jersey. Thank you all for being here. And without further ado, let's dive in. Now, first, I'd like to pass the floor to Timothy, our inspirational advocate from NAMI Westchester, who will share his valuable insights and perspectives on tardive dyskinesia.
Yes, I go by Timothy Paul Brown. I have been living with, I was first diagnosed with Tardive Dyskinesia in 1983. And then in 1984, I went on a medication regimen and have been on it ever since. Early on in my recovery, I did not take a side effect pill. They thought I didn't need it, but up until 15 years ago, I started showing signs of tardive dyskinesia. It has only progressed since then, but the treatment that I use for tardive dyskinesia is speech therapy, being that I cannot, my body won't tolerate the ingredients in today's modern TD medication, so I had to find an alternative, and that was the speech therapy. I'll say a little more about tardive dyskinesia. I am a poet by nature. That is my gift. And I've always read my poetry in front of large crowds. I think the largest crowd I've ever read in front of was like well over 200 people. I prided myself on my speaking. I had what they call a silver tongue, but after a while of reading at functions, people say I can't hear all your words, you have to enunciate. And I thought that I had no idea what that was until up about 7 years ago, when they wanted to put me on cogentin for the side effects. I couldn't take that. Then they wanted to put me on other modern TD meds, but my body won't tolerate that because of symptoms. I have been diagnosed with suicidal ideations, even attempted suicide, and that's why I cannot take modern day TD meds because of that side effect. So the only alternative, which my therapist and I came up with, was speech therapy, and I have been in speech therapy for about a year. It helps. It doesn't take away the problem, but it helps because there was a point where people couldn't understand me at all. I was so illegible. My words were so illegible that people couldn't even figure out what I was saying. And to me, in my mind, it was them and not me until I came to grips with the fact that I do have the symptoms or the side effect. So I'm very much aware of it now. I try to slow down my speaking. I try to enunciate my words. So when I'm talking to somebody, it will be clear what I'm saying. People can understand me. So that is my story with tardive dyskinesia. My advice to somebody with tardive dyskinesia, first and foremost, if you are first getting on a psychotropic, mainly for schizophrenia, when you are first on a psychotropic, my suggestion pill in the future, that would work, because you can't take a side effect pill after the fact, because once you get TD, it's irreversible. And then I would say if you have gotten TD, look at all your options and decide from there, but work closely with a therapist and a doctor, mainly a doctor, work closely, and so they can tell you where you're, or if you do in fact have TD. So that is my experience. That is my solution to tardive dyskinesia. And the last but not least is the advice I gave you about tardive and how you can prevent it and how you can treat it. That's about it. So I'm going to read a bio. This bio was sent to I believe it was Marie. And it simply goes this way. Hello, how is everyone doing today? My name is Timothy Brown. I have written 7 books of poetry since 2021. I have been writing poetry since 1975. I've always had a way with words. My poetry has touched on the lives of so many people in and out of the system. I have been in poetry contests. I have had my work published in an international magazine. I was also featured in a Fountain House monthly magazine. I also have 4 of my books in their library. I have 4 of my books in the Westchester library system, and I'm in the NAMI Westchester library. I have been on Channel 12 News. I have been in blogs, podcasts as well. In 2021, I was awarded the title of Client of the Year with my clinic, and they purchased 100 copies of my books. As a young man, I was very athletic, doing sports like pole vaulting, wrestling, and gymnastics. I came from a very abusive background. I grew up with physical, mental, and sexual abuse as well. I believe it was because of my abuse I gravitated towards substances like marijuana, cocaine, cigarettes, and alcohol. I started using at 11, and I was a full-fledged addict by the age of 17. Sexual promiscuity was a huge part of my story. I became an emotional cripple, and I had no concept of what love was about. With the trauma, the drug abuse, the streets, and incarcerations at a young age set the stage for over 30 hospitalizations. I was in rehabilitation centers, detoxes, shelters, halfway houses, and I was on the street with no place to go or anything to eat. I was put on the streets by a family member who knew that I was incapable of finding shelter or food, so I roamed the streets for at least a month. As I said in the beginning, that I am a poet by nature. I wrote poetry throughout my whole life. It saved me from myself. I wasn't writing to be recognized. I was writing about survival. People would tell me that I should write a book. I never paid much attention to that because I had no real belief in myself. It took from the time I started writing in 1975 up until 2021 to publish my first book. Writing is a part of a whole as far as what helps me. I went to AA and NA for years and learned so much about life through slogans, quotes, and meditation. As a result, I have been clean and sober since 1996. I also see my current therapist. I'm sorry. I also had cessation classes for my cigarette habit. It took many years, but I finally quit in 2005. I started seeing my current therapist in 2017 after a major operation and a psych hospitalization. I was in bad shape, mentally and physically. Her support kept me out of the hospital. Her support kept me out of the hospital for the last 7.5 years. We practice DBT and have developed a strong bond. Everything she does is individual based. I feel like a unique, powerful human being that has something to offer the world since we started seeing each other. I'm on a medication regimen that is my foundation. For me, I wouldn't be able to perform day-to-day things like bathe, socialize, avoid drugs and alcohol, keep up my mental hygiene. I also see a neurologist, dermatologist, general practitioner, eye docs, or dentists who I see on a regular basis. If I didn't have the support that I have now, those simple things would not be done. I have many supports that make up a whole, which is me. I have myself. My illness is a part of who I am, and I don't throw it away or minimize it. I am now taught to find myself and make decisions on my own mental health because I'm the one who lives with it. I see practitioners as guides to our true selves, and I no longer see them as miracle workers. I respect the fact that they're human. I understand that they have many people's lives in their hands. I'm aware that they treat dozens of people throughout their work week, and that means that they're affected by dozens of people's circumstances and personalities, which can be very stressful. I respect the work that they do. What's next for me is my autobiography. I want to be a bestseller, and I want to be an international spokesperson for the purpose of empowering those with mental disorders. I've never had a career. I want representing organizations like NAMI to be my career. I'm aware that just about every human being that has ever existed has been touched by mental illness, whether it be personal, a loved one, or people with mental health disorders, or mental health practitioner, or someone curious about mental health issues. Mental health is in all forms of media. Mental health is in all forms of media. I want to use my experience to enlighten, empower, and reach all those who's affected by mental illness in any form or fashion. Timothy Paul Brown.
Thank you so much, Timothy. We are all touched by your story, and your perseverance just shines. Thank you so much for sharing. And now I would like to give the floor to Vice President of NAMI Hunterdon, Shay Dibley, to talk a little bit about this condition.
Yes, and that's tough to follow. What a great story. It was very inspirational and a story of perseverance and creativity throughout all of what you've been through, Timothy. Hi, I'm Shay Dibley, NAMI of Hunterdon County. I was our chapter, NAMI Hunterdon, was one of the awardees of the Tardive Dyskinesia Awareness Grant. And we made a video about 8 minutes long. It's part of the resources of this video. And I'm here to very simply just describe definitions, symptoms of the disorder. Then I'll go into common misconceptions of tardive dyskinesia, their link to psychiatric medications, and impact on quality of life. So while I do that, definition and symptoms, tardive dyskinesia is a neurological syndrome that involves involuntary movements caused by taking certain medications. The term tardive means delayed or late, and dyskinesia refers to abnormal muscle movements. Tardive dyskinesia TD is a serious side effect of taking antipsychotic medications, as known neuroleptics or major tranquilizers, to treat mental health issues. It can be caused by medication, and symptoms include blinking rapidly, chewing motions, frowning or grimacing, grunting, puffing out cheeks, smacking or puckering lips, sticking out the tongue, and other things that can involve the extremities, the legs, the hands, the feet. Tardive dyskinesia, there's no known cure, but a medical professional, as Timothy was mentioning, can manage and help you improve the symptoms. Stopping or tapering medications may be causing TD can help. However, we'll go over that it's not always reversible, as Timothy also mentioned. It's more likely to develop in females, older adults, and people of African American descent. So that is from our resources we have. Then our common misconceptions about tardive dyskinesia include believing it only affects older adults, thinking it's always easily recognizable, assuming reversible once medication is stopped, and not realizing that low doses of antipsychotics can still cause it, and mistaking nervous movements for the symptoms of tardive dyskinesia. Only a doctor can help you to diagnose, treat, and you need to work as a partnership with them. But it can be subtle. Involuntary movements can start associated, be like lip smacking or facial twitching, may not be immediately noticeable by others or even the person experiencing them. Not always reversible. Even if antipsychotic medication causing the TD is stopped, the symptoms may not completely disappear, could even persist or worsen in some cases. The dose matters. Talk to your doctor. Even low doses of antipsychotic medication can still contribute to the development of tardive dyskinesia, and distinguishing normal movements from maybe a symptom of tardive dyskinesia is always difficult. Sometimes need to work with a neurologist. Like Tim was saying, he works with a group of medical practitioners. Now we'll talk about the link to psychotic or psychiatric medications. Antipsychotic medications known as neuroleptics or major tranquilizers are the main cause of tardive dyskinesia TD. The serious side effects that includes involuntary movements that we already discussed. The main examples of antipsychotic drugs, you might have heard of risperidone or risperidone, Zyprexa, olanzapine is another name for Zyprexa, Seroquel and Seroquel extended release, quetiapine, Geodon, which is ziprasidone, Abilify, and that's apiprazole, if I'm pronouncing that right. Impact, but the impact on the quality of life is the last section of this, and it's going to be noticeable, uncontrollable movements in the face and body, leading to social isolation, embarrassment, and a sense of decreased self-esteem, often impacted daily activities and relationships. The visible nature of the symptoms in severe cases, it can hinder employment opportunities and other factors of life. So there's social isolation, psychological distress, functional impairment, impact on relationships that the people have. However, sometimes I'm told by a doctor that the symptoms might not be too noticeable by the person experiencing them, and yet also might not be concerning the person that is experiencing them. So that all has to be taken into consideration with a psychiatrist as well. And therapy, medication adjustments can be made also under care of a doctor. Specific medications are now have been released for tardive dyskinesia. Medications like tetrabenazine and valibenzine, sorry if I'm mispronouncing, are specifically designed to treat tardive dyskinesia symptoms. Therapy, cognitive behavioral therapy, can help manage the psychological impact of TD. Tim touched on that as well, including coping strategies and self-esteem building. Again, something that we've gone into already, but I appreciate you having me and hosting me and having the floor for a little while. And I think I'm going to help Timothy in another section, but I appreciate it again. And I think it's time to turn the floor over again to Marie.
Thank you so much, Shay. And thank you so much for helping us understand what tardive dyskinesia is and why it's often misunderstood. Now, joining us again is Marie Hunterdon, Executive Director of NAMI Westchester. Marie, you'll be leading this next section, and we will all join in.
Sure, that's great. I'm counting on it. Everyone joining in. Hi, everyone. Marie Hunterdon, ED with NAMI Westchester County in New York State. And we are so appreciative to NAMI New Jersey for bringing us in. And we're happy to be part of this great forum because it's really important to get this information out there. Also, of course, thank Neurocrine for the funding, which we had gotten some funding as well. And we did a webinar in May. And that's available on our website, and that can go out with the resources that will be sent out by NAMI New Jersey in case anyone's interested in learning even more. Thanks also to CPALs for your involvement and to volunteers such as Timothy who share their journeys, because that's what it really comes down to, is hearing from someone who lives with this disorder and we can learn from them. We can read all we want about medications and symptoms, but when we hear someone personally share their lived experience, that's when it really comes to life. So thank you for making this possible. NAMI Westchester County, just as a little background, does very similar work to NAMI Hunterdon and other NAMI affiliates. We are the local affiliate. There are 24 in New York State, and we have a state affiliate just like NAMI New Jersey does. And we support, educate, and advocate for people who live with mental health conditions and their families and loved ones, as well as the larger community, through evidence-based programs and support groups for young people, for people living with mental health diagnosis, and for their families and loved ones. Because that's how NAMI was really founded, really to support people who are supporting others. We have certain initiatives, including a faith-based initiative, a wellness initiative, including yoga and community art. We've worked with the county Suicide Prevention Task Force to create a healing garden in our county, at which we will host an International Survivors of Suicide Loss Day event this Saturday morning. I'm sure you have some International Survivors of Suicide Loss Day events in your area. You can look on the AFSP website and probably some NAMIs as well. So just a little bit about who I am, who we are, and what we're doing. So what I wanted to talk about here is discuss how to find help within our communities, right? So like I said, NAMI New York, NAMI in New York has 24 affiliates. There are more than 600 affiliates across the country. And there's a national organization and state organizations. So wherever you go, you can find a NAMI, and they will be versed on tardive dyskinesia and other disorders and offer programs for you too. On the NAMI.org website, you can do a search to find the NAMI affiliate near you. So some of the things that were brought up were treatment options. So I wanted to talk about that a little bit. Different treatments work for different people, right? So Timothy, you mentioned some of the treatments that really have helped you. I just kind of made some notes are, you had some hospitalizations, you did have some addictions that were addressed. You do take medication. I think you call that your foundation, right? And it sounds like you're doing a good job of handling daily living skills, because I know that that can be a challenge, right? And that you have goals. So those are things that are really helping you in your journey. That's what I got from you. So can you share from your experience, and maybe Shay as well, any additional treatment options that you may not have mentioned, or I may not have remembered that you mentioned, or that may be helpful to someone else?
I practice meditation. Meditation works for me, but it's not like traditional meditation. I have YouTube on my TV, and I put on different meditations like nature sounds, Reiki, chakra music, binaural beats, anything that puts you in a state of relaxation or rest. And I'll turn it on and I'll listen to it all night long, not awake, but it works subconsciously for the anxiety. So I use that. But as far as the actual tardive dyskinesia, like I said, I cannot use traditional medication for it because of my diagnosis. Certain medications I can't use because it exacerbates it. I've had severe, throughout my life, suicidal ideation and attempts. So it would be like throwing gasoline on the fire, basically. So I don't take TD meds, but I do the alternative, the medication and speech therapy. That works for me because my speech therapist told me when she first met me and started talking to me, she told me that I was like almost 100% illegible. Nobody could understand it. Kept asking me to repeat myself. So there are other alternatives. I'm not saying that people with TD should run to speech therapy, but what I'm saying is that they should discuss the options with their practitioners. And that's what I did. And I would say that there are times when I'm rushing my speech or talking and people can't understand, but if I'm conscientious while I'm speaking, conscientious of how fast I'm speaking, then I can slow it down. And I was also taught to enunciate my words, so it'll be more clear for people.
And thank
Sounds
you.
like you're incredibly self-aware,
Yeah.
right? That's impressive. So
Yeah.
is that something that you've learned over time? Have you always been very self-aware?
It was a process. It was like I will be very aware. I don't even know what to attribute it to, but I could go for being very aware and wise. Could last 1-2 years, and then I go to psychosis. When I say psychosis, I don't mean acting out. I mean mentally, mentally reacting. It's another word I'm looking for. This not. There has been times when I've been in remission. I wouldn't say it's easier to say it that way. There has been times when I've been in remission. I could have been in remission for 2 years, and then all of a sudden something aggravates my illness. But I must say, and this is the appropriate thing for me to understand, is that I've had my current therapist for since 2017, and I have not been in hospital. That speaks for itself.
Finding the right therapist, the right team, right?
Yeah.
To work with you.
Yes.
In good times and in bad, because you need to see them all the time. And one of the things I'm looking in the chat here, I'm seeing a lot of questions, a lot of personal stories, but all in all, I think to answer to your question, Marie, too, is the cognitive behavioral therapy, besides medications and lowering doses of antipsychotics and maybe taking a tardive dyskinesia medication to offset. I think cognitive behavioral therapy is available in a lot of intensive outpatient programs. So when an individual is getting to a psychotic point in their life, sometimes inpatient isn't right for them, but a day program where they go each day and check in with their medications, have cognitive behavioral therapy, can make a big impact on somebody who's having especially co-current symptoms, maybe tardive dyskinesia and psychosis at the same time, to get them back on track. So I think that is important to know, that there's an element, like just like Timothy said, he's been with the same therapist since 2017. If it ain't broke, don't fix it. That's a good thing. Stay well, if you're well. But if you're not, try to get one piece of the puzzle going at a time, whether it be, maybe it has to be inpatient, but maybe it doesn't. And there are each person's symptoms and life experience is going to be quite different. So we'll have to know that in everyone's case, they're might have to take a little bit of a different path, but know that there are options out there for you.
Right, and every day there are new modalities that are coming up, new ways of treating things. I mean, even in Westchester, St. Vincent's Hospital has just opened a supported crisis housing unit that they've never had before. And there are beds for 15 people. Each room is individual. So, and they do take insurance. So that's maybe a step before going to the hospital, and it would be a 28-day stay maximum. And that could just kind of get somebody back on track, not having to go to the hospital and then go back to their community. So, you know, I mean, having that therapist is amazing since 2017. And I know that your writing has been part of your recovery and your poetry, right? So having that extra interest or hobby or something to go to, and also people in your life, right? Because like I said, that's part of how NAMI was formed, was having people in your life and having them know what's going on and having them educated. So Shay had mentioned some external, you know, recognizable symptoms. So Timothy, did you recognize those symptoms yourself, or did someone in your life call them to your attention and then you took it upon yourself to get help?
A friend of mine who's also a poet, we would go to readings and poetry contests,
Mhm.
and we would both read, and sometimes we would read our poetry to each other. And he brought it to, this really annoyed me because I thought that he wasn't paying attention. So he was saying to me, I can't hear you clearly. You have to enunciate your words. And that really got me messed up. I'll just say it got me pissed off. But years later, more people start saying the same thing. So that's when I started paying more attention to it. I had to get over my pride and ask for help. Doctors have noticed it, but like with my pride, I'm not taking another medication. But I should have, like a device I gave. They have medications that you can take when you are first put on a medication regimen. These side effect pills, such as Progetin, Artane, they're specifically made to keep the psychotropic from giving you tardive dyskinesia. So if I was smart, I would have done that from the very beginning. I wouldn't have this issue. And also, if you, by some sad chance, do get tardive dyskinesia, your best bet is to work with your psychiatrist. I have a neurologist still. Work with your neurologist, your psychiatrist, have them work together and come up with a solution on how they can best treat you. That's the only thing I emphasize: work with people. Don't put this all on yourself. You have to work with people.
Sounds like it takes a village, right?
Absolutely. I'll say this. This reminds me of, I was 18 years old when I went to the hospital. I was kind of erratic. This is typical 18-year-old. But one therapy aide, he was older, wiser man, he said to me, look, no man is an island. And that's all he said to me. I got mad because I had no understanding of what he said or what it meant until years later, I realized he was saying that no man stands alone. We're all connected to a bigger piece. And being that no man stands alone, that means you depend on the rest of people as well as being self-sufficient.
Absolutely, absolutely. One last comment I'll make, and then I'm going to hand off to Shay. But Timothy, you've become a wonderful advocate. You know, just having your voice heard, having your story heard, and by you inspiring others and educating others is truly amazing. So I want to thank you for that, because that is something that is so important to NAMI, having people with lived experience share their personal journeys, because that's how we educate one another, and that's how we bring people in, and let people know, what it's all about, and the best way to help you. And you really inspire others. So thank you so much for sharing your voice.
Thank you.
Now, Shay and Tim, I'm gonna lead the next.
Yeah, thank you, Marie. That was really well done. I like how we all had input in that section. And I think we're gonna finish off with the section, the diagnosis, the early warning signs we've talked about already quite a bit, but we're just going to touch on it. And the steps to diagnosis, of course, we've already also, Timothy was so great about talking to his neurologist, talking to a psychiatrist. He sees a dermatologist. You got to have everything, kind of healthy mind, healthy body. Everyone's story and trajectory in recovery is different, and then after post recovery, your life that you live and you go. One of the things I wanted to ask, and it might be of note to Tim here, is Tim, I play the piano, and I like to play the piano more when I'm going through maybe more of a tougher time myself with my own struggles. So I was wondering what stage in your cycle, like you said, you have maybe you're good for 2 years and maybe you have a little step back. What stage in that is your best time to write poetry?
Usually when I was in dire straits, like when I was having symptoms, or I was very emotional or paranoid. For some reason, it seemed like my best work came from those times. I've had some really deep. Yeah. But at the same time, people, a lot of things that I wrote, they only make sense to me. I mean, they're written very well, and people enjoy them.
That's it. You're a walking advocate. You're so inspirational because you're advocating, and this is what it's all about. And that's the last point that we're going, is the importance of advocacy. The importance of what you're doing, Timothy, is that you're getting your word out. There's so many people on this chat, if you don't see, have questions about their own loved ones, and we can't always provide the answers. We can't. We're not trained, licensed professionals, but we are all advocates of one mind. In a mind that my own personal struggles that I have, nothing like yours, but I mean, I play the piano when I'm more in a tougher time, and I feel that I enjoy it more at that period of time. So I was wondering, as an importance to advocacy, to get, like you said, the post treatment, what do you do to continue your treatment in your own life? What do you continue to do that keeps you going, right? You say you want to talk at NAMI events. I think that's great. But for me too, it's important to know, because I sometimes play my best piano when I'm feeling like that. I really do. And I think advocacy starts with, with a story, and your story is carrying us through this webinar really. Maggie, how are we doing on time?
We are doing a little bit, we are a little behind, but this is great conversation, and actually very much in line with our pre-submitted questions. So these are great discussions. Yeah. And I think that I wanted to also chime in about the last point that Timothy and Shay, you mentioned, is this, because we are talking about TD today, and it is a drug-induced real condition. It is not just a side effect. So we wanted to go back to the real person, the whole person approach, where because Timothy's story really speaks to the essence of recovery, meaning that Timothy has found himself being whole again through care, through being in a therapeutic session where he was treated as a respectable person. And I think that that is one important takeaway for us all as well. And I wanted to also talk about stress because the questions came up about that does stress cause it? And TD definitely has a lot to do with stress. Stress itself does not cause TD, but they go hand in hand. So that's why that when writing poetry, right, and Shay, you said playing piano, definitely those are things that we can find stress relieving. And then that will be important to practice calming activities by yourself or with others. And that will create a better sense of well-being. And there's a question about yoga, right? We definitely see yoga as part of that, the relaxation, the guided meditation, or taking walks, hiking, exploring nature, setting aside time just for yourself, or discovering hobbies, such as piano or poetry or gardening. And those are something that speaks to how we help ourselves, and also to get help from others, to reach out to people who can provide support and guidance. And that speaks to NAMI's role, like Marie so well said there. So that's something that we have seen many times that's been helpful besides going to treatment. So I have been posting several links on the chat. If you can read up there, there will be great information there you'll find about treating TD and the condition itself. So thank you, Shay and Timothy. So right now, before I go to the question and answer session, I wanted to bring in the last point, which is near and dear to my heart, because I wanted to address the experience of TD in racially and ethnically diverse community. The importance of spotlighting this lens stems from a decade-long interest of researchers to look at ethnicity and movement disorders. And research findings have noted ethnicity as a risk factor in the development of TD and potentially also a factor in the prognosis of the condition. So that's why it's important to see TD from that lens as well. We know that the current data suggests that individuals from Black or African American communities may have a higher risk of developing tardive dyskinesia compared to other racial groups. But it is something that more research has to be done to fully understand the factors behind this disparity, which could include genetic predisposition, medication sensitivity, and disparities in healthcare access and quality of care. We will email you a fact sheet after this webinar that touches upon this very crucial consideration of TD among racial and ethnic diversity, the communities we see. We'll also share an infographic that we just got recently from the Impact TD Registry, which suggests that Hispanics and Black Americans struggle with more severe movements and had greater impact of their movements than other racial ethnic groups. So I'm from the public health background. So from the public health lens, in order to increase access to care for underserved minority community members with not just tardive dyskinesia, but also for serious mental illness, the solutions should focus on addressing systemic barriers like healthcare disparities, cultural competence among providers, improving health literacy, increasing awareness about the condition itself, and ensuring affordable access to treatment through insurance coverage. So we, on the one hand, we are, through public health campaigns, underserved communities can become aware of the condition and how to treat it, right? And the benefit of regular screening, talking to the doctors. But on the other hand, we also need to continue advocating and supporting policy changes at the state and federal level to address healthcare disparities and improve access to care, including maybe future policies that will remove barriers to routine screening and monitoring for TD, which our community members may not have the power or the leverage to do. So we would love to shine a spotlight on that need. So looking at the time, we do want to really come to the questions. There are some questions that we received before the webinar. We have tried our best to address them in our conversation just now. But some of the new questions we got here, let's see how much we can go through. There are actually themes here. So the first one, maybe I could ask the panel, can tardive dyskinesia symptoms lead to psychosis episode? A good question. Anyone would like to take that?
If you're talking about leading to I'm not sure where this is with the average person offers a psychiatric diagnosis or a symptom, but for me personally, the more my speech became legible, and more I saw how people responded to me, it didn't do good for my self-esteem. Because to me, it seemed like to other people that I was conversing with, felt like saw me as stupid or less intelligent. When I know I'm above average intelligence, but it was frustrating to see the reactions that I was getting from people. So I did have psychosis as a result of it. This was, I believe it was 2021. I had a major nervous breakdown. And I know that TD played a large part in that. I felt isolated, like it was. I know TD for me personally has been a cause for depression and things like that. Self-esteem, self-worth, how I view myself.
Thanks, Timothy. And
yes, go ahead.
thanks, Timothy. And just to piggyback off of what you said, in the interest of time too, is also that if you start to have symptoms you think are tardive dyskinesia, go to your doctor instead of stop taking the medication that's causing it, because that can cause psychosis. If you stop suddenly the medication that's helping you feel better, even though it's causing these symptoms. So you do want to be under the care of a medical professional with that. Yep.
Thank you so much. And definitely, we also post some links there in the chat, and we'll email it out after this. It talks about that, and thank you, Shay and Timothy. And the next theme would be that some of the family member here sharing about their loved one's symptoms and the names of the medications, which I'm not going to mention here, but they see symptoms like tapping of feet, shaking, staring, confusion. So is that TD? And that is the theme of several questions here. Sharon, Marie?
I think I'll give you an example of a very close friend of mine who's also involved with NAMI, who has essential tremors, but he got diagnosed with essential tremors because he went to a neurologist and got diagnosed with essential tremors. But he thought he might, after when we were applying for this grant, he thought he might have TD because he takes medication for his bipolar. And so what happened then is he got diagnosed with essential tremors. So he knows how to treat that. So I'm just saying there are other movement disorders that don't have to do with tardive dyskinesia or anything along those lines, even if you think that that might be the case. But you should go to a neurologist, most likely will have the best chance to diagnose and start treatment for if you do believe that you have a movement disorder.
Mhm. Thank you so much. Marie, anything to add to that?
No, I completely agree. I think Shay did a good job of explaining that, because it really comes back to a professional to make that determination of which is it.
Absolutely. Yes.
And Timothy has that all lined up. He's got a neurologist. So.
Yes.
Mhm. Yes. And so the one question asked what triggers TD, and as such, it says that we don't have the symptoms daily, rather maybe once a week. Can it be physical stress or work or school stress? And once the symptoms start, is that an indication that may be leading to a more severe condition, like psychosis-related conditions? So it is related to what we have talked about, right? Mhm.
If I can chime in just for another minute here, I'm told by a psychiatrist that came to our NAMI New Jersey conference that in general, tardive dyskinesia shows itself within 7 to 10 years of being on a medication therapy, usually. So if it has been maybe 25 years since you've been on the medication, it's probably not likely that you're going to develop tardive dyskinesia. Now, that being said, see a psychiatrist, see a neurologist, but that's what he has said to me from his professional knowing of the movement disorder.
And I think that's a really good point, is that it's really important not to self-diagnose, because there could be, let's say some kind of tremors in your hands. It could be, I can think of 5 different things, including diabetes, that could cause something like that. So it's really important to just get the help as soon as you recognize a symptom or two.
And if you have symptoms of psychosis, also go get that taken care of. Psychosis is equally or more important right away to get taken care of, or depression, major depression, or the symptoms that are presenting themselves might be just one thing. I don't think you need to worry about, does this cause this or what? You kind of need to just get over to your doctor and start a treatment plan and see what needs to happen, and try to be a partner with that professional. Yeah,
absolutely. And TD really is distinguished from other movement disorders primarily by its characteristic repetitive involuntary movements. So to find a psychiatrist or a neurologist sometimes could be helpful, but Maria and Shay, you're absolutely right about finding a specialist. We have posted a link here on how to find a local specialist if you don't know where to find. This is provided by the talkabouttd.com. Then there, you not only you see the type of mental health provider, but also whether or not they're accepting new patients and how many insurance carriers they accept, as well as whether or not they would provide telehealth service if you can't travel. So I would highly recommend, if you are in adult, definitely go find a therapist and definitely talk to your current providers about the symptoms, new or has been going on for some time, because to Shay's point, it does develop over time. So yes, so I think that we are at time, and I am truly grateful for this wonderful and fruitful, meaningful conversations. We've covered a lot of ground here. And remember that NAMI is here to support you. Contact your NAMI local chapter for resources. Visit NAMI.com and local NAMI's websites for more information. Join our support groups like Marie mentioned, and education programs as well. So our panelists, would you like to add any final thoughts?
I just want to let people know on our local websites like NAMIHunterdon.org We have a lot of resources that are local, including what I mentioned, like an intensive outpatient program for those who are needing some support that may not want to go to inpatient. And the telehealth is very important these days. If you can't get, or if you feel a barrier to getting the therapy or the help that you need, please still get it. Please still go to find who's accepted by your insurance and get that help that you need.
Thank you.
All right, one last thing to say. Marie, is she muted? Oh, Marie, yeah. Is it possible you could get one of my books over to Shay for one that donated?
Sure, I'd be happy to. We are the appreciative recipient of a stack of books that we have a lending library on our website. And Timothy spoke at the NAMI New York State conference a couple weeks ago, and he donated a number of books to us. So I'd be happy to figure out how to get one to Shay for sure.
That'd be great. I would love that.
Thank you so much.
Timothy is a brand new In Our Own Voice presenter, and he's going to be doing his first presentation next week, I think. So very excited about that.
That's great.
Wonderful.
And remember, guys, NAMI is in nearly every county of every state of every state in the union. So we're out there, many of people like us in your community, wherever you are.
Awesome. Yes. Well, thank you all. And special thanks to Timothy for sharing your insights and your books, your offer of books.
Thank
To
you,
our
Tim.
audience today, thank you again for joining us. We'll be sending a follow-up email with resources and a link to this recording. Remember, you are not alone in this journey. Take care.
Bye-bye.
Thank you.